Hi, everybody. I first want to introduce myself. My name is Sara Robbins. I'm part of the administrative support team at the Health and Counseling Center here at DU. I am the patient advocate as well as the insurance specialist on our team. So when it comes to any questions about insurance, I'm always happy to help. Most of our team is pretty well versed in insurance issues, so they're also happy to help if you can't get a hold of me. I also want to start off by saying thank you so much for joining and watching this video. I'm sorry that I couldn't be there for the live webinars. And I know that insurance can be a little bit of a dull subject, but it's a super important one for both your financial well-being as well as your students' financial well-being. So I really appreciate you taking the time. I know that we can't answer any questions right now, as it isn't a live video like all the other ones, but at the very end and throughout the presentation, our contact information is there, so don't hesitate to give us a call if you have anything that needs to be answered. So I'm going to go ahead and share a PowerPoint with you all, and we will go through this. Okay, again, so this is the presentation about the Health and Counseling Center. Specifically, we're going to be talking about insurance and cost of visits, things like that are all about the Health and Counseling Center. So you're going to probably see this next week as well, but I think it's really important to reiterate, our mission. And so we want to provide exceptional, inclusive, and integrated healthcare. So that we can promote success and wellness, not just to make sure that your student's healthy, but to make sure that they succeed in their education. We also want to provide advocacy as well as outreach, so your student is getting the most care that they possibly can. And we also want to make sure that we're providing culturally competent clinical services, which include medical treatment, outreach programming, advocacy, and training opportunities. So our structure, we have 6 different departments within our own department. So we have medical services, counseling services, CAPE, which is the Center for Advocacy, Prevention, and Empowerment, health promotions, the collegiate recovery community, and the administrative and finance department. So we're going to be talking mostly about the administration and finance department. I think next week on the 31st of July is when the other teams are going to be speaking more at length about the services that they provide, so you are aware of what your student can come in for. So the first thing about insurance is that all students are required to have health insurance while on campus. So if you don't have insurance, we do offer an insurance plan. One of the big things that we need to reiterate is that we don't bill to the insurance companies at the Health and Counseling Center. But even with that, we provide really discounted care for most students. So we'll go into the cost of care in a little bit, but first I'm going to talk about the health insurance that we offer. So the student health insurance plan, as we refer to it, it's SHIP, is a platinum plan, and it is underwritten through United Healthcare Student Resources. The plan has a $3,150 deductible, plan premium. But if you choose to opt into it, you get billed in two different billing cycles. So the first billing cycle is the fall billing cycle, and you're going to get a bill for $1,575. And then again in the spring, you would get another bill for $1,575. It is a plan that covers you for 12, or your student, my apologies, for 12 months. So it starts September 1 and it goes all the way through August 31st if you're on the quarter system. If you are a law student watching this or a parent of a law student, it is going to be from August 1st until July 31st. So the deductible for the plan is $1,000. So once you hit that deductible, that's when coinsurance kicks in. So 15% coinsurance, which means you are required to pay 15% of the cost. And then the out-of-pocket max is $1,500. So all the money that you spend goes towards that out-of-pocket max, even the deductible. When you do opt into our health insurance plan, the Health and Counseling Center, it does become the primary care provider. So anytime your student needs care, they need to come to us first. So say they come in and they have a hurt knee, they need to come to us, and then we can write the referral to go see like a physical therapist or an orthopedic surgeon, something like that. Same with if your student has the flu or a cold, then your student needs to come into us to get primary care. Otherwise, the insurance company will not cover it. I kind of alluded to this, but all referrals are required to be issued from the Health and Counseling Center, from one of our providers, and that includes medical, but also counseling. So if you want to go out into the community to see someone for counseling, you need to get that referral. The one exclusion to this is if you're more than 50 miles away from campus, you can see a primary care provider that's in United Healthcare Student Resources Network, and it will be billed as if they were coming to the Health and Counseling Center. But if you're within the 50 miles, you need to come here. Otherwise, the insurance company will not cover the cost. But the plan does cover students all over the U.S., as well as when they're studying abroad. I really urge you all to check out your plan and see what your student is covered with. I think a lot of parents are surprised to find out that they might have a Blue Cross Blue Shield PPO plan in, say, New Mexico, but then they come to the US. They come to Colorado and find out that their student isn't covered in Colorado except for emergency room visits. And so just making sure your student is adequately covered. On our website, there is a whole link where you can go through and see what we consider an adequate plan to be. So plans cover primary care, which we include as mental health care, that is going to cover up to $500,000 a minimum of $500,000 per illness or injury. We want to make sure that it's affordable for you all, but when you need to, for yourself, weigh out the pros and cons of having a more expensive insurance plan versus the benefits that it covers. So just thinking about those things are really, really important when coming to Colorado and coming to DU. So if you do not want the health insurance, there is a deadline. It is September 27th. Once your student has registered for classes, which I believe at this point, most of your students should already be registered for classes, you'll be able to waive the health insurance. If you waive the health insurance before your student registered for classes, you are going to need to go online and waive it again. The system's a little quirky in that way. You need to be registered and taking classes or registered to take classes before it will allow you to actually process the waiver. So the health and counseling fee is a fee that is auto-assessed each quarter. For undergraduate students, it is a required fee, and it is $200 per quarter. It helps decrease the cost of medical care and counseling costs at the HCC. So like I said, we don't bill to health insurance, but the cost for services here at the Health and Counseling Center is very reasonable and oftentimes cheaper than someone might pay with their copay, for instance, to go see a primary care provider. So we're gonna dive into that. So looking across the screen, we have students who are on the health and counseling fee and the student health insurance plan. When you come to our facility, almost every service is gonna cost you nothing, which is a big deal. The only time that you would pay out of pocket is if you end up getting a prescription. So we have some antibiotics. We have a really small pharmacy here. So if you get some antibiotics, you might have to pay for that. We also do have a cap in terms of like specialist visits. So the first 6 visits are going to be at no cost. After that, there's a very nominal cost for visits. And that's the same with our counseling. If you go over 20 counseling visits, there will be some cost that's incurred, but again, really minimal. So most of you are probably only going to have your students have the health and counseling fee. So with the health and counseling fee, medical and mental health visits start off at a $20 copay. So mental health counseling appointments will always be that $20 copay until a certain number of sessions, but most students don't even go over that number. Medical, the visit cost will be a $20 copay as well. But if you were to get labs or anything like that, it is going to be an additional fee, but it's discounted. So the example I like to get is that a lot of students come in the fall you're with new people, new surroundings, lots of germs are getting mixed around. So a lot of people come in thinking they might have the flu. So we'll do a flu test, a strep test, and a mono test, say, in a visit. So you're going to be paying $20 for the visit, and then an additional cost for the lab work that's being done. But it probably won't cost you more than $35 to do those lab visits and the visit cost itself. So a lot of the times that's a really good deal. Some people copays are more than that for a primary care appointment. We can always provide your student with an invoice so you can send to your insurance company. A lot of people find that it will go towards their deductible. So you can have that, but a lot of people just pay out of pocket or use their HSA cards, their health savings account cards, to pay for the cost of these visits. Again, really discounted services for psychiatry, dermatology, and nutrition, which are specialist appointments. And we have a lot of students coming in with allergy shots. So every time you come and see a nurse, it's a $20 visit to get that allergy shot. So if you're not going to have the health and counseling fee or the health insurance, everything will be paid 100% out of pocket. We're always happy to help with how you submit a claim, things like that with your student. Most of you are not going to fall into this category where you're not going to have the health and counseling fee, but just so you know, like if your student were to come in during the summer and they're not taking classes and they're still eligible to come in and get services, the cost will increase. But these numbers can get really confusing to people. One of the big takeaways is that we have the health and counseling fee, which is not a health insurance plan. It's essentially a discount program. And then we have the student health insurance plan, which truly is an insurance plan through United Healthcare Student Resources. So those are the big differences, and what you pay out of pocket with, depending on which coverage you have, is going to vary. So again, feel free to give us a call if you have any questions, things like that. We're always happy to answer them. It's also important to know when the Health and Counseling Center is open. I'm sure they're going to go over this as well next week. But during the school year, we open almost every day at 8 a.m. except for Tuesdays. On Tuesday mornings, we have staff meetings. And then we have extended hours on Wednesdays and Thursdays. So we close at 7 to accommodate for your student class schedule, or maybe you have an athlete and they have practice, things like that. But we are closed on the weekend. This is where we're located on campus. We have 3 different facilities, and they're going to go into a deeper dive next week, but the Ritchie Center is our main facility where both medical and counseling services are offered. A big question that we get a lot is what happens when the Health and Counseling Center is closed? How can my student get care? Well, one thing is your student can always give us a call. Even when we're closed, there's someone on call, a medical provider and a counselor who can help your student over the phone. If they think that something is worse, they might send you to an urgent care or the hospital, or your student to an urgent care or hospital, but it's a really excellent resource that we have. If your student does need to go to an urgent care or to a hospital, we have an urgent care that's just down the road. It's about a 10-minute walk from our facility. And then we also have the Porter Adventist Hospital, which is about a mile away. I think it's important to mention that with the health insurance that's offered by the school, if you go to an urgent care, you must go after hours. So when the Health and Counseling Center is closed, to get coverage for that visit. And for a hospital visit, you can go at any time. It's just you're always going to incur larger costs, which I'm sure most of you would know. But if you didn't, then try to avoid the hospital if you can. Again, I know that we can't actually answer questions live, but feel free to give us a call. I'm actually going to pull up this next screen here with our email address and phone number that's really large, so you can get that written down if you need to. We're always happy to help. Our website has a ton of information on it. It's a lot of information, but most of your questions can be found, or the answers to your questions can be found there. And then finally, there's a student checklist. All of you should have received this little mailer in the mail. It's about all the services that we provide. It's a really nice breakdown of everything. And it also has all of the pricing that I talked about today in here as well. It also has this really nice checklist to do. So the first is make sure you're waiving that health insurance if you don't want it. It is automatically assessed to the account. So if you don't waive it, you will end up paying for it. And I wouldn't want you to pay for something that you don't need. Then if you haven't already done so, make sure you get those immunizations sent in to us. The state of Colorado does require us to provide this proof of information or proof of immunizations. And last but not least, come and visit us. I really think it's a great idea during orientation week to make sure that your student comes in and sees where the facility is, because it's really hard sometimes to find a location when you're sick. So it's better to do it when you're feeling well, so you know where to go when you do need help. Anyway, that's all I have for today. Thanks for paying attention. Again, I know that this is not exactly the most exciting information, but it is important. Feel free to give us a call, send us an email. We're always happy to help. I look forward to meeting some of you all, and I hope you guys have a great rest of your summer with your student before they're here at DU with us. Have a great day, everybody.